All right, good morning. I'm Dr. Meredith Warner of Warner Orthopedics and Wellness in Baton Rouge, and thank you for joining us on our webinar series. This is just entertainment and information purposes only, of course. Any medical advice is not being given, you know that. You have to go talk to your own doctor. But I'm going to talk to you about my research, everything I've learned over the years, and in my practice as an orthopedic surgeon. And today we're going to be talking about exercise. Now, just so you know, I have this book, Bone on Bone, that I wrote, and the whole premise and purpose of this book is to help you get empowered to treat all of your aches and pains yourself, feel better today, and a side effect would be healthier and have longer life, right? But one of the main facets of this is exercise, and I'm going to kind of break that down today in this talk. And it's not as intimidating as it sounds. Okay? All right. So this is going to be sort of a guide for how you could stay active as you get older. We're all getting older. Nobody's getting any younger that we know of. So we're going to talk about how to stay active, because if you don't stay active, you're not going to be active as you get older. So the old saying goes, a rolling moss gathers no stone, a body in motion stays in motion. Yes, momentum is a conserved thing in the universe. That is a law of nature. So if your momentum is zero, it's going to be zero when you get older, which is not going to be a fun old time for you. There will be no golden years. But if your momentum is good, if you're moving, you're going to conserve that and you're going to stay happy and healthy. So we're going to talk about the health benefits of exercise, different types of exercise, some guidelines, a couple things about safety, and then things about motivation and consistency, because unless it's consistent, there's no point in exercising, right? And then some practical tips for you. A lot of my patients have never exercised, they've never played sports, they don't really know where to start or what to do, and so we sort of guide them, and I'm just going to give you a few of those pointers today. Really? Okay. I just got called out for saying sort of, so I apologize to all of my grammar people out there. Okay, why should we exercise? I think it's sort of one of these fundamental self-truths, right? It should be self-evident, but if you sit back and think about it, why do we exercise? Did humans ever exercise? When we were evolving on this planet, did anybody go out and exercise? I don't think so. So why do we do it now? And then what is exercise? And then why is it helpful for health? And what is the evidence? So exercise, the definition is, it is a planned, structured, and repetitive activity with an object of improving fitness or maintaining fitness, okay? Everybody remembers this guy, Richard Simmons, right? He's one of the first people to bring exercise to the masses. Well, yeah. Okay, sorry, technical issue. And it happened again? Okay. So remember, we've been on this planet, we don't really know how long, a bunch of years. And like I said, humans didn't evolve to exercise. Nobody evolved to have a Richard Simmons show up in the street and start doing planned, structured, repetitive exercise with the goal of maintaining fitness and achieving fitness, right? All we did was run around, look for some berries to eat, hopefully plant a few plants, maybe kill a deer or two and have some food, right? So if you look at the hunter-gatherer societies that are still around on this earth, believe it or not, in the year 2024, they don't do planned, structured, repetitive activity with the object of improving fitness and maintaining fitness. So why do we do it? I'll tell you why. Because we have to. We don't have a choice. Because everything is so easy. I just got groceries delivered this morning. I have a remote control. My car starts with a button. Like, nothing is hard anymore, okay? So for us to even get the normal, fundamental movement that is required for the human body to even exist normally on the planet Earth, facing all of the forces we face, you've got to do something, because we don't even have to walk down the street to go pick a berry. Like, we don't have to do anything anymore. So unfortunately, exercise is a side effect of modern society. And whether you like it or not, it's got to be part of your life in some way, shape, or form.
Loretta says hello, and
Hey, Loretta.
Angela says hello. Good morning.
Hi, Angela. Good morning, everybody. Okay, so this is just a little funny slide in here just to show you one technique of exercising. I'm a big Star Trek fan, you may or may not know. And this is a game I found online that if certain things happen, and this is from the first season of Star Trek, you have to do certain exercises. So These are just ways you can gamify things. Now this works really well for kids. So like Uhura giving her opening hailing frequencies on the show, you have to do 15 jumping jacks. Kirk's shirt comes off, you got to do 10 push-ups. Kirk hitting on a female, regardless of species, 10 lunges, so on and so forth. So there's ways to gamify exercise and make it a little bit more interesting in your life. Or maybe during the commercial break of your favorite news program, you just get up and walk around the house for 3 minutes. Just doing that, how many commercial breaks are in a 1-hour news program? You would be getting far more exercise than you normally would. So don't start thinking about this like, oh, I have to go to the gym and I've got to look like this version of Dr. Spock. No, you just have to move.
Nancy and Missy and Kathy.
Oh, Nancy and Missy and Kathy. All right. I wonder if they're all together. All right, go.
They just said good morning.
My favorite is, of course, when Dr. McCoy says, damn it, Jim, I'm a doctor, not a whatever. Then you got to do 10 crunches. All right, next. I don't know if anybody out there is quite the Star Trek fan that I am. All right, why do we exercise? To me, it seems sort of silly, right? Like, why do we do this? You require physical activity to regulate energy expenditure and to coordinate certain physiologic processes. So nothing in your body works without movement. You have to exercise. We exercise now. Back in the day, it wasn't exercise. Unless you have energy expenditure, there's certain regulatory functions that are not going to happen in your body and in your brain. Regular exercise, although the act of exercise right away actually increases inflammation on a short-term basis and increases reactive oxygen species on a short-term basis, over time it reduces chronic inflammation and it improves the function of your immune system and it lowers the risk of disease. Now, when I say it improves the function of the immune system, of course I mean within reason. There are some studies that show that people after endurance activities like ultra marathons and things like that actually have more risk of getting sick, like they've actually beat up their immune system so much. But the exercise I'm talking about that I'm going to teach you about is actually better for you. And over time, your immune system will work better. You'll be able to fight off viruses and pathogens better, which means your risk of getting a cold, a sinusitis, or God forbid, a pneumonia is going to be lowered. So there's about 1 million reasons to exercise, but just remember the last time you had the flu or something like that and how bad you felt. If you exercise on a regular basis, the odds of that happening drops precipitously, okay? And lower risk of disease. And I'm talking about diseases like stroke, Alzheimer's, blood pressure, diabetes, cancer, cardiovascular problems, you name it. Any chronic lifestyle disease, the more you exercise, it is like taking a pill to prevent it, okay? And then you're gonna release your endocannabinoids. You may or may not know what an endocannabinoid is. We've talked about this before. That is your body's eat, sleep, and forget system. So you have this system inside of your system that is sort of like the maintenance crew. And it just makes sure that everything else is working well. Make sure your circulatory system's working well. Make sure your vagal and sympathetic system's working well. Make sure the skin's happy. Make sure the muscle's happy. So the endocannabinoids, that's why medical marijuana works so well for people, because it harnesses the endocannabinoid system. And one of the supplements I make for people for nerve pain is called PEA, palmitoyl ethanolamide, and that is also an endocannabinoid, and it regulates how the nervous system works, and it reduces inflammatory or neuropathic pain. When you exercise, you can do this naturally. And this is sort of the runner's high that people get. Now, I will tell you, I think I had the runner's high once in my life, and it is an amazing feeling. So all the runners out there that actually get this, that is awesome. I got my runner's high when I was in Afghanistan, and I was running the perimeter with maybe the world's best surgical tech ever, this young man, Manny, and he was actually from Ecuador, and he was gaining his citizenship through the military. I don't know if you know that's possible, but he was doing that. He was awesome. I love him to death. He's from Washington State, which is where I was born. Anyway, we were running the perimeter, which happens to be this like, gosh, how big? I think it was 10 miles, a 10-mile loop. And obviously I was in much better shape then. And towards the end, we were just going so fast and just sailing and gliding, and I got a runner's high. That was endocannabinoids. That's a totally natural thing. So you can get this just from lifting a weight, just from swimming, just from riding a bike. Now, you may not get the quote-unquote runner's high, but you will definitely get a better sense of well-being and just feel better and be happier. And it's gonna be so subtle that you probably won't even notice, but if you sit back and think about it, you say, you know what, I really felt good today. Oh, I took a walk this morning before, while the sun was rising. It was awesome. Okay? The other thing to think about with exercise, the more skeletal muscle you have, the less of hyperglycemic risk you're gonna have. So the way your body pulls glucose or sugar out of your blood is through muscle. Muscle is your #1 glucose sink. So the more muscle you have, the less likely you're gonna get diabetes. And if you have diabetes, the better you're gonna control your glucose. And then of course, the whole purpose of exercise and movement, everything is social cohesion. So we're humans, we like bonds, we like to have relationships. And one of the best ways to do this is with exercise. So back in the day, it was group hunts, group runs, group dances by the fire at night. It's a way to connect to people and gain that social interaction, which is one of the ways you enhance your life and live a longer life. And then one way I think about it is LSU football games. We go watch people exercise, but that is a massive way to gain social cohesion. So sports, as you know, are a huge part of our society, and it's because of the social connections that they provide.
Will you please
Stop moving.
take the mic that's pointing on your jacket right there and point it to you?
Oh,
Not let it rub on you.
all right, sorry. Better? Okay. Sorry.
No.
Hope that didn't mess up the
Big
sand
hand.
for everybody.
Big
So this is what I'm talking about, social cohesion. Now, this is an LSU Tiger game. This is Tiger Stadium. Obviously, nobody here is exercising except for the guys on the field. And, you know, we can debate how much exercise football players do. Just kidding.
You walk like miles a day tailgating.
No, you do walk miles. Actually, I brought my parents to an LSU tailgate game, and they were in their late 70s / early 80s, and that was a lot. You walk like probably 5-6 miles easy just getting from where you park in through all the tailgates, because what you see here in the stadium, there's about at least that many people outside tailgating also at the same time. But anyway, the whole point is social cohesion and all of the other health benefits. So there's no downside to exercise is where I'm going with this. Now, why do you want to do it and why do I want to do it? You know these two ladies, Dolly Parton and Betty White. I want to be that awesome when I'm older. I want to be active, I want to be fit, I want to be cognitively with it, I want to have friends, I want to just be interacting with life and society. These are icons of American society, and they are both very active and take very good care of themselves.
Betty's dead.
I know, Betty White passed away, but at a very decent age, and she had a very, very productive and happy life, as we all know. So I don't want to have a stroke or heart attack. I'm sure you don't either. I want to be able to get up off the floor if I'm going to be playing with little kids like grandkids or whatever, and I don't want to be stuck on the floor and have to have somebody help me up. I know that's what you want. I want to not get a hip fracture. If you get a hip fracture, the mortality rate is about 30 to 50% within the first year afterwards, okay? You don't want that. I want to enjoy my golden years like Betty White did, and I want to always be able to think well and have cognitive abilities. One of the only ways, or one of the only proven ways to prevent dementia, prevent Alzheimer's, and even sometimes make these disease processes better is exercise, specifically getting stronger. Okay, so how does exercise, what are the health benefits? So specific to cardiovascular health. This top right picture is a picture of a clogged blood vessel. That yellow goop is the atherosclerotic plaquing that sometimes coats the inside of your arteries and then prevents blood from getting through, okay? Or a piece of that flips off and goes form a clot and gives you a stroke. So you have reduced levels of LDL cholesterol and other problematic things like triglycerides if you exercise, and it prevents heart attack, stroke, peripheral arterial disease. Proven in study after study. It improves the heart capacity and the ability to perform, okay? The ejection fraction, or how much blood your heart pushes out. It lowers blood pressure. And then also there's a reduced risk of metabolic dysfunction. If you've watched my other talks, you know that 93% of Americans are metabolically dysfunctional in one way or another. So exercising helps to reduce that risk and maybe put you into that 7 to 10% of Americans that don't have metabolic dysfunction. Reduces the stiffness of vessels and puts less strain on the arteries. So lowering your blood pressure means your heart doesn't work as hard and you have less risk of these plaques flying off and causing havoc when they land in the lung or the brain. Weight management. So exercise in and of itself is not really a great way to lose weight, but it is a good way to maintain weight loss once you lose the weight, because you will have more lean body mass. I've already told you that muscle is the biggest glucose sink, so it'll store the glucose in the form of glycogen, which is like human starch, think of it that way. And then also the lean body mass is the number one determinant of your resting metabolic rate. So the number of calories you're burning just sitting around doing nothing, that is your resting metabolic rate. And that will be higher if you have more muscle, because the muscle just works harder, has to produce more energy on any given basis. Okay, so the more muscle you have, the higher will be your resting metabolic rate, which will help you maintain weight loss. And then exercise also enhances your mindset and your mood and makes you better able to have self-control. Your executive functions of your brain are better. And I gave a whole talk on mindset, so you can watch that to understand what I'm talking about. But you will soon not desire unhealthy foods as much as you used to if you start to exercise. And you will begin to find that you surround yourself with other people that are a little bit more healthy and enjoy things like exercise and eating well. And so you won't be around people that bring donuts and cake to every party. Rather, perhaps they bring a tray of vegetables with some healthy dip or something like that. So you'll get better social grouping to have a health mindset. You'll be around people that exercise and they're gonna have a healthier mindset, okay? So you've got your, I put this bot, you probably can't see it, on the bottom with the cookie, it says zone of self-control, zone of ecrasia, and zone of self-control. So ecrasia is a total lack of self-control. That's what we don't want. Exercise enhances your ability to have self-control, and you'll be able to eat less unhealthy foods, maintain weight loss, and also just be generally healthier and happier. So again, a million benefits to exercise. Okay, mindset assistant, we just briefly talked about this. People that exercise have less depression. People that exercise have less anxiety. I have a lot of patients that tell me, I have to keep running, doc, because if I don't, I get so anxious. And that makes sense because it reduces anxiety. It reduces mental stress. It reduces the stress that is put upon us by our everyday life in this modern society. It helps you to increase your focus and increase your ability to concentrate so you become, I guess, a better performer at whatever work or family task you have, okay? Or volunteer task. And then, best of all, if you exercise, your sleep quality improves. This is an image from the famous marshmallow test, which was a test done by some child psychologists in the 70s, I think. And what they did was they put kids in front of marshmallows and tried to see how long they resisted and what techniques they employed to be able to resist. And this was just measuring executive function and self-control in children. So the whole point of this image is just to make you, I want you to remember next time you see a donut or something and you have to exert self-control to avoid it, just remember some kids had to do this when they were like 4 to avoid eating a marshmallow, and they were just being observed by scientists to see if they were able to do it. The kids were, so hopefully you can. Okay, cognition, these are 2 functional MRI scan kind of cartoon depictions of functional MRIs of a brain with exercise or somebody that does exercise and a brain of somebody that doesn't. So randomized controlled trials of resistance training. So what am I talking about with resistance training? Weightlifting, right? Lifting weights, lifting something heavy, making a force to fight gravity and use your muscles, okay? That is resistance training. Randomized controlled trials of cognition of people that use resistance training or people that lift weights or do heavy things have better attention, better memory, better verbal fluency, and better overall global cognitive function. So this is your number 1 weapon against dementia, okay? Improved neuromuscular function, meaning the connection between the body and the brain was improved in people that had more muscle, lifted heavy things, progressive overload. And we're gonna talk about how to do all of that. I'm not sure what my producer's doing right now, so just bear with me.
Checking the lighting.
There's different random ring lights going up. So if there's glare in my glasses, that's why.
Yeah, I'm trying to hide it.
All right, exercise 2 is to date really the only effective way to achieve longevity, except for maintaining good social connections. So if you've got a group of friends with whom you can take a walk or lift weights or do some sort of exercise, you are achieving the 2 best ways to enhance your health span and your lifespan. Exercise, tight social bonds. That's it. That's all you have to do, and you're gonna beat out anybody that's spending gazillions of dollars on whole body MRIs, blood tests, genetic testing, specialized diets, personalized healthcare, all of that. At the end of the day, all of our studies show us exercise good social connections, and you're gonna be fine, okay? So you'll be able to maintain your body's physical abilities over time. Look at this lady, she's in her hundreds, out there farming, picking, it appears to be algae, a great source of omega-3s, by the way, and out there living her life. And look at the mobility she has. Look at the knee flexion this person has, the ankle flexion she has. Obviously, she's able to get up off of the ground, right, without an issue. There's nobody there to assist her. I don't see a walker. So this is possible for not just her, but for all of us. And you'll be able to maintain your cognition as you get older. Nobody wants to get older and be plugged into a machine, right? Nobody wants to get older and not be able to think. Nobody wants to be a burden on their family. I'm telling you, the way to live older and not do all of the negative sides of it is to exercise. The life expectancy projections, that's what this map shows, so you probably can't see it, but the darker colors represent, by 2100, we think people are gonna live to their 90s easily. So that's like Australia, Canada, parts of Europe. Now, sadly, in America, it's only gonna go to 80, 85, but remember, America, we take in a lot of immigrants every year, so our population is not really stable, so it's hard to really get the same life expectancy as you would with a stable, cohesive, homogeneous population. But that's an aside, okay? All you need to know is if you exercise, especially if you exercise with friends, you're gonna be better off than really most people in the world. Okay, types of exercise. So some of you probably know all the different types of exercise. Some of you are probably experts. I have a lot of patients, like I said, who know nothing. So I'm kind of gearing this talk to people who probably don't have a great innate sense of what exercise is. So there's aerobic, strength, balance, flexibility. Now what I'm showing you here is just some kids playing with slime. Well, get your grandkids, particularly if you have grandkids in the crafting age range, have them make you some slime, tell them you want it kind of like putty, a little bit less like slime, and just start working your hands and you'll improve your grip strength and your dexterity and your coordination. And then you've bonded with your grandkids, they're helping you live longer and be more mobile in terms of dexterity. This cartoon here says when you take all your groceries in one trip, and then I've shown a parking lot of Walmart. Why did I bring those two pictures? Somebody out there has probably guessed. That is opportunistic exercise. So anytime you have a chance to exercise, you should. So I stress to my patients, please don't park at the closest spot at Walmart. Please pick the furthest spot at Walmart, walk into Walmart, shop, walk back out. And ideally carry your bags if you can. Now obviously that's not possible for a lot of trips to the store. But my point is just that little walk there is gonna be more than most people would do in an entire day in terms of movement. So anytime you have the opportunity to move a little bit more than you normally would, you should take it. Okay, aerobic exercise, that is when you get your heart rate up and you're using oxygen as part of the process of making fuel so that your body moves, okay? Because remember, you can, or maybe you don't remember, you can also produce energy in your body without oxygen. That is anaerobic metabolism. And that happens like when you first start moving when you're like using glycogen and creating, I guess, ATP directly without the electron transport chain. That's a whole nother talk, but aerobic is when you're using the electron transport chain in your mitochondria, you're actually consuming oxygen in the production of ATP, you're breathing in and out rapidly, and your heart rate's up, and think of it like Jane Fonda-like stuff, like Richard Simmons, like you're really moving and breathing heavy. This is what will improve heart and lung fitness to a great degree, okay? It'll enhance blood flow to the brain, lowers your cholesterol levels, improves cognition, boosts mental health, and enhances sleep quality. So sounds familiar, right? Really all exercise is gonna do this for you. Aerobic is really more focused on your VO2 max or your ability to use oxygen efficiently, okay? And that decreases as we get older, which you don't really want. So aerobic activity has definitely gotta have a role in your life, but if you're gonna have one exercise to do and you don't have a lot of time, I'm always a fan of just going with resistance exercising first. But aerobic is super duper important, and all that means is you just take walks with your friends, okay? Take some walks. Zone 2, walk fast enough that it's a little bit hard to have a conversation, but you can still talk. That is zone 2. Zone 1 is when you're walking so slowly that you could have a dissertation and read a novel out loud and it would be no problem. You need it to be a little bit harder to hit into zone 2. So that's like brisk walking. Okay, so zone 1 or 2, preferably zone 2, 5 to 30 minutes a day. That's all you got to do. Now, some people will laugh and say 5 minutes a day, but they've actually studied this. Even 5 minutes a day for people that don't do anything is beneficial and has really massive benefits for the cognition and the physical body and longevity and preventing disease. So if you don't do anything, even a 5-minute zone 2 walk once a day, doesn't even have to be every day, is really going to benefit you. Now, if you walk and talk with someone, you're achieving multiple goals. You're doing what's called dual task or in your brain. So your brain has to not only function to walk and maintain your balance and forward motion, which is all physical, neural, muscular connections, but it also at the same time has to be able to have cognitive abilities to have the conversation with your friend. That is great brain training to prevent dementia. So dual task improvements. Another reason to try to do walks with friends or something like that, pickleball, whatever. Just having the ability to enhance and do 2 different tasks with your brain at once is an awesome thing for you. Dancing, I have a lot of patients that do ballroom dancing, samba, whatever. It helps not only with aerobic capacity and some strength, but coordination and balance, and of course, social cohesion. Now, a lot of people out there probably have osteoporosis, and you probably take osteoporotic drugs, right? And the whole point of that is to prevent fragility fractures, specifically compression fractures of the spine, where you become that hunched over little old lady that nobody wants to be, or hip fractures, which at the end of the day are very dangerous, can actually kill people. Well, what people forget, and what I try to remind my patients of, is not only do you need to have strong bones, but one of the number 1 ways to prevent hip fractures is to improve your balance. And we'll talk about that later, but dance is a great way to do that. Pickleball, I'm sure you know, it's taken over the country by storm. It improves agility, aerobic capacity, and again, social cohesion. And then swimming in groups, walking in a pool, aerobics in the pool exercises for people that really have a lot of issues in terms of pain and haven't overcome that yet. Read my book. All of this promotes social cohesion, dual task use of the brain, okay? And also improving the aerobic capacity and building a little bit of muscle and getting all those health benefits we talked about. This is a picture of Audubon Park in New Orleans. Okay, strength. I cannot say enough about strength. This is a picture from a middle-aged to older age natural bodybuilding competition. So this is a thing now. A lot of women my age group and a little bit older are starting to get more and more into fitness and bodybuilding because I think, not because of the healthcare industry, not because of the medical industry, and certainly not because of the pharmaceutical or the food industry, but the anti-aging wellness industry has been pushing, this is welling up from the people, from the ground, how important exercise and muscle is. So obviously it is possible to build muscle as an older woman, and obviously as an older man too, but a lot of women forget that you have this ability if they ever knew you had this ability. Muscle is directly linked to your bone health. We know how important bones are. It's directly linked to your brain health. It is directly linked with your ability to function as you get older. We've already talked about glucose management and weight control and weight maintenance. And then your resting metabolic rate. There's a reduced risk of early death, the less sarcopenia or the more muscle you have. You have better joint function, and there's a lot of muscles that cross joints. So for instance, the triceps attaches here, so it's crossing the elbow joint. The brachialis and biceps cross, and the biceps, the long head crosses the shoulder and the elbow. So a lot of these muscles that cross different joints can effectively act like hydraulic shock absorbers for your joints. So again, better joint function and less pain. Oh yeah, please share. And if you have anybody in your world that you think doesn't exercise enough or needs to know about exercise, share this talk with them. Hopefully this will help people. So again, resistance training. So there's even different types of resistance training or different ways to think about working a muscle. So there's hypertrophy, endurance, strength, and power. Hypertrophy is when you make things bigger. So that's what bodybuilders do. They say, I'm going to work on my biceps and make my biceps bigger. My anconeus will be bigger. My pronator teres. So they pick specific muscles that they use in these competitions and hypertrophy. Okay, they make them bigger so that you can see them. Endurance is more like for functional athletic endeavors, like with the Olympics just ended. So those long kayak races, the rowing, the running, that is endurance. So muscle endurance takes a different type of training than does hypertrophy. Because just because you have a big, beautiful muscle, it doesn't mean that it can last very long or exert power. Power is very important for sports. So power is the force plus velocity, right? Or with velocity. So you may very well be able to do, let's say, a 10-pound curl, but if you can only do it, that slowly, that is not very powerful. Now, if you can do it like that, that's a little bit more power, right? So power is the force and velocity. What you need for functional aging is really just strength. So any work you do on your muscles needs to be focused on improving strength. Once you get strong, then you can worry about things like power and endurance and hypertrophy. Personally, I don't really want hypertrophy. I just want strength, maybe power and endurance. But strength is really, really what you need, okay? And this is relatively easy to get, believe it or not, but it does require consistency and it requires progressive overload. So you may start with this guy and then you may end up with this guy, right? But you got to start somewhere. And I'm telling you, if you start, your body has an amazing ability to change and it will get stronger, no matter what your starting point is. All right, so how do you get strong? There's a very simple way, and again, I talk about it in the book a little bit more in detail, but I'm gonna break it down for you right now. All you have to remember is 3 by 5, okay? 3 to 5 different exercises. They need to be whole body, full range of motion using the joints, okay? 3 to 5 different exercises. 3 to 5 repetitions, 3 to 5 sets with 3 to 5 minutes of rest between the sets, 3 to 5 days a week. So that sounds complicated. If you're just a beginner, I would just start with 3. You're gonna do 3 exercises, 3 reps, 3 sets, 3 minutes between 3 days a week. You really could even just do 2 days a week, to be honest. And it's important that you actually don't do it a lot unless you're really, very advanced. Because if you're just starting out and you're just trying to build muscle, your body has to have time to build the muscle. So you stress the body senses the stress, and then the muscle cells say to themselves, I might be stressed like that again. So guess what happens? They bring in amino acids and synthesize protein and create more muscle, or make the muscle that's there a little bit more efficient. And so every time you do this to your body adapts and becomes stronger. So what is a rep? Some of you might not know out there. So let's say you're doing curls, that's 1 rep. 2 rep, that's the repetition. Remember, it's structured, repetitive activities. So a curl, I'm gonna do 3 reps. Okay, now I'm gonna rest 3 minutes, then I'm gonna do 3 reps. That's all you gotta do. You need to start with a relatively heavy weight for you. That's how you build strength. So some people, this is it, 2-pound curl bar, that's all they can do. Some people are deadlifting 200 pounds, but the person deadlifting 200 pounds certainly did not start there. The person just curling 2 pounds probably hasn't done much of anything for a long time. But once you start, you will get stronger. You cannot help it. You cannot overcome the nature of your body. With rare exception, of course. All right, next.
Ask if there are any questions on it.
Are there any questions on this?
You can have 3. Just 3 reps.
Yes, you can have just 3 reps. Now, generally, the question was, can you really get stronger with just 3 reps? Yes, but like I said, it has to be heavy. Technically, it should be 70 to 80% of your 1 rep maximum. So if you know that you can only, and I'm saying curls because that's the easiest way for me to show you. If you know your 1 rep max, the most you can curl is 5 pounds, then you would start doing these exercises with 4 pounds, more or less, okay? So it needs to be heavy enough to matter, but not so heavy that you're gonna go to failure or you not be able to do it. Next slide, please. Okay. All right, balance. So again, super duper important as we age, often forgotten and not thought about. Okay, balance usually decreases with age. Why? Because vision changes inner ear function changes, hearing changes. People get neuropathic or start to have diminished sensation on the bottom of their feet, right? Their ability to sense their position in space, their proprioception goes down. And then the number one reason to get a hip fracture is a fall. And most people fall because of a balance problem, okay? So we know that hip fractures cause a high death rate, and if they don't kill you, they cause a significant depletion in your physical abilities over time. So you really don't want to get one of these, so you really want to have good balance. Also, you'll have better coordination. You'll be able to play normal activities. You'll be safer on any given day with any given task. So for instance, I've seen people step off of a curb, and because they lack coordination and sense of space, they step off incorrectly and they roll their ankle and break it. So those kind of little minor problems are going to be diminished the more balance you have. And importantly for all of us, you're going to be able to play with your kids and your grandkids better. You'll be able to go out there and toss the football, be able to play frisbee, you'll be able to go golfing, things like that, if you've got good balance and good coordination. And then of course, again, back to the social part of exercise, you will gain confidence if you have good balance and coordination, and you won't be afraid of doing things, and you'll get out there and do them. A lot of my patients have told me that they are just scared to do anything because they don't want to get hurt, because they lack balance or they lack this or they lack that. Now, I have a very crack ace physical therapy team, and we work and improve people's lives all the time. A lot of you don't have that, but I would, find the person in your family who does exercise and ask them for help. Start working on your balance. If that's your main impediment to getting out there and getting stronger, is you're scared you're going to fall, then you got to find somebody to help you work with that.
Somebody asked why do hip fractures have such a high death rate?
Why do hip fractures have such a high death rate? Somebody asked. Well, great question. There's a number of factors at play, obviously. I was going to say that's more epidemiological. Probably because when people break their hip, you get in bed rest, you're laid up for a while, and then anytime you're in bed rest, you lose a significant amount of muscle mass. Your bones get inactive, your joints get stiffer, and you lose a little bit of cognitive ability. Malnourishment happens. So basically, every time you're laid up in bed with something as devastating as a hip fracture that takes a lot of work for your body to heal, you're depleting the rest of your physicality and mental abilities at the same time. And then, sometimes the hospital care isn't that great. And then a lot of these people after hip fractures get put into rehab or SNF units or extended care or whatever. And we all know that those don't have the greatest reputation for taking great care of people in many cases. And so there's a lot of social isolation, there's a lot of poor nutrition, there's a lot of depression associated. So there's a bunch of reasons that go into early death after hip fracture, but just think of it like a massive insult to the body that you have to overcome. And usually this happens to people who have poor balance, poor muscle mass, and are deconditioned to begin with, if not already cognitively down. In fact, a lot of hip fractures happen in people on their path of dementia, right? So that's why. Now, if you can make it through the first year, then you're fine, right, in terms of the death rate, more or less, but your overall functional abilities are usually downgraded by a unit or two because of that loss of muscle, loss of balance, depletion of your resources while you're healing from the hip fracture. So these are a big deal, and we really don't want to have them.
Kathy Howard said, thanks for getting me to start my physical therapy.
Oh, Kathy just thanked me for getting her to start physical therapy, and you're welcome. I'm a huge fan of physical therapy. I think that a lot of orthopedists don't appreciate their physical therapists enough, but the physical body, the ability to use your body is innate to being healthy and having less pain and aging well. And so the physical therapists are masters at that, and they can help you with any problem and find a solution. Now, balance work, go join a Tai Chi club, a Qigong, or yoga, okay? Restorative yoga if you've never done yoga before. So Tai Chi and Qigong have been studied and are shown to improve balance and reduce rates of hip fracture. And guess what? Usually you do these with groups of people. So again, you're achieving multiple goals at once. Simple things like single leg stances, heel to toe walking, working on a stability ball, or even just sitting on a stability ball when you're sitting at your computer. Side leg raises. This is tree pose in yoga. Now, you don't have to start like that. You could start with your toes of the left leg on the ground and just your heel touching the ankle. Start somewhere. Now, if you've got terrible balance, you don't really want to be doing tree pose on your own at home, right? Just make sure you've got something to stabilize yourself against, or better, a friend or somebody there who knows what they're doing to help you. But balance is super important. Once you've gotten the balance down, then you could start getting out there and doing more activities like pickleball or walking or golf or whatever. So I'm showing you this picture, which is obviously a bit exaggerated, but almost every time somebody gets injured in my practice, they're doing something like this. They're on a ladder changing a light bulb. They're cleaning the gutters. They decided to, change the filters in the air, and, they have a wobbly ladder. That comes down to balance and your sense of position in space. So you're going to reduce your risk of being injured doing normal household activities if you improve your balance. Now, osteoporosis drugs are very, very good, and if you have osteoporosis, you should be on one of them. But they don't have the same ability to prevent a hip fracture as balance does. If you've got great balance, it's almost a 100% risk, 100% reduced risk of falling, right, for no apparent reason. So I would suggest not only working on your bone health in terms of calcium, D3, magnesium, and osteoporosis drugs, but I would say you should also work on your balance. Flexibility. So obviously this enhances your mobility and your independence, right? You'll be able to get up out of a chair without your hips creaking. You'll be able to put your shoes on yourself, tie your shoes yourself, different little things like that. And then posture will get improved if you're a little bit more flexible. So poor posture is a function of contracted tissues in the front and stretched out tissues in the back. So enhanced flexibility will make your posture better. Posture is super important for almost all aspects of life. That's almost its own talk. Just know that it is super duper important. And then if you have less tension on the connective tissues, meaning the fascia, the ligaments, the tendons, things like that, even bone is a connective tissue, and skin, right? You will have less tension and stiffness, which it translates into less pain. And then the more flexible you are, the better your blood vessels are too. So you're not just enhancing the flexibility of stuff that you can notice, like your tendons and ligaments. Everything gets a little bit more flexible. And then you will have enhanced circulation, better muscle health. In addition, a muscle is only as strong as its range of motion. So like if you can't use your shoulder in its whole range of motion because you're stiff, you're gonna be weaker by definition because you won't have that full use of the muscle. So more flexibility goes into more strength, which goes into all the benefits we're talking about.
I don't know if you want this right now. Does supplements for osteoporosis? Or
Okay.
Those don't seem to be connected.
For osteoporosis and what?
Bursitis.
Bursitis? Oh. Somebody's asking what are the best supplements for osteoporosis and bursitis. For osteoporosis supplements, I would say omega-3, D3, magnesium, calcium, and vitamin C, because vitamin C is integral to how the collagen bundles cross-link inside of connective tissues. For bursitis, I would say anything that reduces inflammation, which is, of course, again, omega-3, D3, but I would also throw in some flavonoids like tart cherry extract, turmeric, things like that. Okay, how do you achieve flexibility? Well, again, just like with strength training, remember there's hypertrophy, endurance, power, strength. And with aerobics, there's different levels of aerobic activity, zone 1, 2, 3, 4. Flexibility, you can static stretch, ballistic stretch, dynamic stretch, and we're gonna go through some even more types of stretches. Static stretching is what this guy's doing. You just hold a position for 15 to 30 seconds. For instance, the hamstring stretch. Now, notice he's only made it to his mid-calf, but he started somewhere and he's doing it. Now, eventually you may be able to wrap your hands around the foot while you're doing it and have your nose touching your knee. But even just starting here is a great thing to do. Just hold it 15 to 30 seconds and then you just go a little bit further and hold that. Ballistic stretching is a little bit less safe. I don't really recommend this unless you're kind of a high level athlete. This is when you're bouncing or jerking and increasing the range of motion using momentum to help you do that. This is when you push your body beyond its normal limits of flexibility. For instance, a toe touch bounce. So you would get up and you would just bounce until you eventually are able to get as far as you want to get. This isn't the greatest for beginners, so I don't recommend it. Static stretching is good, it's safe, that's where you should start. Dynamic stretching is like leg swings before you go for a run, or arm strings before you play basketball, okay? You're moving through a full range of motion, but with control. Ballistic's a little bit less controlled. side. Okay? Proprioceptive stretching and isometric stretching. These are, again, different types of stretching. So stretching and contracting a muscle, this is usually done with a partner, is proprioceptive training. So proprio, like yourself, like you're sensing yourself, okay? This is a hamstring stretch, proprioceptive. So the partner pushes your leg, and then you contract the hamstring. So you're like resisting the stretch. And then when you let go of that contraction, usually the partner can push the leg even further and you get a better stretch. So that's sort of like using the muscle's ability to contract against itself, but it ultimately makes the stretch a deeper stretch and a better stretch. Isometric stretching is when you tense the muscles in a static stretch position, okay? So remember the hamstring stretch where he's leaning forward like this? So in that point, you would make your thigh tight or contract your quad and your hamstring, like you would isometrically, meaning the muscle doesn't change length. So you're just making your muscle hard. Hold it, relax, and you'll be able to stretch further, okay? So contract the muscles without moving, and then you're gonna hold the muscles while you're in that static stretch position. So this will not only increase your flexibility, but even the isometric contraction of your muscle, making a muscle hard even when it's not moving, that actually makes you stronger. You don't even have to have a weight. Okay? Passive stretching, this is when you use like an implement, like a tool. So this guy's using a little belt to help do his little hamstring stretch and also stretching his heel cord. So this is when you're like, one of the plantar fascia stretches we talk about in the healing soles, when you take a towel around your foot and pull back, that is a passive stretch. So it's passive but also static, right? Now, what you could do at the same time when you're pulling the towel on your toe, you could push against the towel and fight it. Then you're engaging in isometric stretch. Then you relax and you can get even further. Myofascial releases, my physical therapists do this a lot for people. This is when you find pressure areas in the muscle fascia and release them through certain highly technical massage maneuvers. And this is, if anybody's out there been to physical therapy and had the metal tools that they scrape you with, the Graston tools, that's a technique of myofascial stretching. This relieves tension in the fascial area and allows the stretch to deepen and relaxes muscles and reduces pain. And then active isolated stretching. This is when you hold a stretch just a couple of seconds, not that 10 to 30 seconds, release and repeat. So you just keep doing this over and over again. Short stretches, but more intense a little bit. And then you're gonna gradually increase the stretch. Now, I put this picture on the bottom. This is a obviously highly magnified image of muscle, but look what's between it. That kind of like filmy, spiderwebby stuff, that is in your body everywhere. That is fascia, that is connective tissue. You have fascia everywhere going in all different directions, holding everything together, connecting to your skeleton so that we don't fall apart in a big puddle of goo on the floor. So that fascia though gets stiffer as you get older, particularly if you keep feeding yourself advanced glycation end products. Also, we've talked about that in another talk. But the worse and more highly processed your diet is, the more likely your fascia is going to be stiffer. And if you don't take omega-3, the more likely you're going to be stiffer. All of that stuff between every muscle fiber gets stiff. It's not just the big, thick pieces of fascia that you can see, like your Achilles tendon and your iliotibial band. It's everywhere in your body. So anytime you stretch, even if you don't think you're doing something for yourself, you are doing something because you're at least stretching that stuff.
You have 2 questions.
Okay, we got 2 questions.
Thoughts on rebounding for bones and joints? I don't know what that means, so you might know if you don't know what it means.
Thoughts on rebounding for bones and joints.
Did they elaborate?
Yeah, are you talking about like ballistic stretching where you're jumping up and down and with a weight? I'm not quite sure if I've used that term, rebounding.
Do they mean like recovery?
I don't know. Do you mean recovery, or is that a type of ballistic workout?
Okay, so in the meantime, we're going to go to the other one and tell her.
All right, I got another question while we're waiting for that question's clarification.
Oh, she said trampoline.
Oh, a trampoline. So what was the question? What about it?
Your thoughts on, I guess, trampolines for bones and joints?
Yeah, so trampolines are great because you're going to be working balance, flexibility, strength, and aerobic pretty much all at once. So I think that's a great technique if you're safe on a trampoline. Yeah, the jumping up and down. Now remember, that's a lot of eccentric work. Granted, it's not on a hard ground, so it's not going to be as hard on your muscles, but eccentric, meaning you're gonna lengthen the muscles as you load it, tends to work muscles harder, so you'll probably get more sore doing that, but that's a great workout.
The little mini trampolines.
Yeah, the mini trampolines.
Okay, this is more of a comment, but I think there's something in here for you.
Okay.
Be careful, a PT hurt me by insisting I keep taking meloxicam, and I was deteriorating. It was causing leaky gut. I was compliant and listened to her. They're not the same. Why are you taking medication advice from
Yeah,
her?
so this person just commented to be careful with physical therapy because apparently she had a physical therapist that advised her to continue taking meloxicam, which is a non-steroidal anti-inflammatory drug. And apparently it ensued in some leaky gut or whatever. I would say anytime somebody recommends a medication, and I'm talking about me talking to you about supplements too, you should always check with your provider, your treating doctor, and make sure that that is okay. And you know, I have a lot of patients that take advice from friends and take the friends' medicines, also not advisable. You should always check with your physician. But yeah, some physical therapists do step over their bounds and make advice like that they probably should not be making. That is a medical recommendation. And usually only doctors are allowed to do that, okay, or nurse practitioners or DOs. So just throwing that out there, the physical therapists, their scope of practice is physical medicine, not pharmaceutical medicine. Just FYI. Now for me, when I do these talks, again, technically this is for information and educational purposes only. I am not your treating doctor unless I am and you're watching this. So I also advise people, you always got to check with your doctor. Your doctor knows you better than anyone, right? In terms of all the medications and risks that you might have for any given thing that you want to start
All
doing.
her MDs pushed it, she said.
Well, okay, now she's telling me that her MDs push the drug. That I've got no,
That's why you made it on but
yeah, I got nothing good to say about that. Sorry, that is why I wrote this book, because I see that all the time too. Harmful pharmaceuticals being pushed on people when there's more natural, healthy ways to treat aches and pains and get stronger and live a happy life. And I'm sorry to hear that happen to you. Yes, a single dose of a non-steroidal anti-inflammatory drug can destroy your gut biome, and it takes a while to repopulate it. Same with antibiotics. So like a lot of my patients, when I treat a lot of diabetics and diabetic foot wounds. We do a lot of limb salvage trying to prevent amputations. And so a lot of my patients are on antibiotics a lot. I often tell them, please take a probiotic or yogurt or something, Greek yogurt with live cultures, to try to repopulate the gut as you're on these terrible medicines. But you have to be on them for a certain reason. But non-steroidals are known for that. Okay, next.
She says, that's why I push your book now.
Well, I appreciate that.
Her name is Marianne.
Marianne, thank you so much. Okay, safety. Oh, look, I didn't even know the slide was coming up. So speak with a healthcare professional if you're gonna start doing stuff that you're not used to doing, okay? Engage a physical therapist to guide you or a personal trainer. A lot of people can't afford personal trainers, but in some of the gyms that people go to, they're there and available. But I think the easiest thing to do, particularly if you're on a limited budget, is go see your doctor and get a physical therapy prescription that should be covered by most insurances. And even if you have a copay, it's going to still be cheaper than a personal trainer. And have them work on your particular conditions, and they can help guide you in a safe manner to become more physical, okay? Gradual progression is the key. Again, if you asked me to go run a marathon right now, I would not be able to. But if you asked me to train for a marathon, I would be able to do that. I should be able to go out, walk a little bit, run a little bit, walk a little bit, run a little bit, start gradually adding things until eventually, yes, you can run a marathon. Nobody starts out looking like Arnold Schwarzenegger. Everybody starts out like a little blob of goo coming out of the womb, right? Gradual progression and then progressive overload is how you do this. And then obviously, I would not ever advise free solo climbing. That is a hazardous exercise, things like skydiving, stuff like that. So avoid the hazardous stuff. There's really no point in my opinion.
You're just getting some love. They love your products. Help with arthritis.
Thank you.
Kathy
We're getting positive comments and I appreciate that.
Kathy Howard, super fan.
But it's delaying my producer's switch to the next slide. Okay, there we go. So again, with exercise, motivation and consistency. You've got to get motivated. I mean, just think about your grandkids, think about your kids, think about this beautiful earth, think about this amazing planet. Get motivated. Get out there and be part of life, okay? But set realistic goals so that you can be consistent. If you are not consistent, then exercise is meaningless, right? Meaning you have to keep doing it or it doesn't work. Understand the benefits of the exercise as you're doing it. Know that you're making your brain better. You're improving your longevity. You're going to function in life better. You're going to have less pain the more you exercise. A lot of people say, I don't want to exercise, it hurts. Well, that's just delayed onset muscle soreness. Muscle soreness is part of life, and muscle soreness is certainly part of good exercise. But that type of soreness is actually, once you learn what it is, most people like that soreness, believe it or not. They're like, oh, I'm sore because I worked out. And they're not upset about it. So understand the benefits of exercise and get a healthy mindset. The number one thing I want you to understand is your body is plastic, and you need to believe in this. The human body has an amazing ability to change depending on the environment it is in, okay? So if you give yourself heavy things to lift, you will become stronger. If you make yourself work on balance, you will get better balance. If you do mind things and learn a new task, like start taking piano lessons, guitar lessons, start doing bridge or start playing Go or whatever, you will get better cognition. You can't help it. You cannot fight the adaptive abilities that are innate to the human condition. So believe in the plasticity of your body. Even if you think you are the weakest, most out of shape person you've never exercised in your life, it doesn't matter. You still have that innate ability to change. And then at the molecular level, remember this. You and me, we are replaced just about every 4 months in terms of the molecules that form a cell. And your cells, in terms of your body turns over about once every 7 years. That's why I put a picture of a locust. Remember, they come out of the earth every 7 years? So you are not you 7 years ago. You've been completely transformed. Every cell is a new cell. So just know that your body is constantly changing, and it is able to adapt and overcome depending on the stress and environment it is exposed to, okay? 1% of your cells are replaced every single day. Your brain turns over about every 6 weeks. And then at the cellular level, again, you are replaced every 7 years. Your brain, your muscle, and your bone will adapt to exercise. You can change, you can get strong. So, something to consider when you exercise. The ship of Theseus paradox, okay? If one plank of the ship of Theseus has been replaced, is it still the same ship? You're probably saying, well, of course it's the same ship. If all of the planks have been replaced, is it still the same ship? This is what's going to happen when you start exercising. You're going to be the same person, but you're going to be a different and better person. Are you going to be the same person 7 years from now? I don't know. It's a philosophical question. The whole point of this, me telling you this, is to make you start thinking, yes, I can change. Yes, I can get stronger. Nothing's going to hold me back. So start small and then celebrate your achievements, okay? And know that you really don't want to add more than 10% a week to any given routine. So progressive overload doesn't mean go from lifting a 2-pound curl bar to a 30-pound dumbbell, okay? It's incremental progressive overload. You just add a little bit more, a little bit more. For instance, recently I wanted to start exercising again, so I started doing push-ups. Start with 1 or 2. The next day you do 3 or 4. Do that for a week. The next week you do 5 or 6. The next week, suddenly it's so easy to do 7 or 8. Then all of a sudden you're doing 15. Next thing you know, you're doing 30. So you can't help it. You'll get stronger and more able to do things with less discomfort. Progressive overload is inevitable. And again, the key is consistency. So if you just started doing 5 push-ups and then waited 4 months and tried to do 10, you wouldn't be able to. You'd have to start at 5 again, okay? I put this picture here because this lady just needs to be an inspiration to all of us. This is a 36-year-old professor in Australia who went to the Olympics to breakdance. You guys have got to find this video and watch it if you haven't seen it. But just have the confidence to get out there and do things and move and just celebrate your ability to do it and your body's ability to change. Have realistic goals. She didn't get a single point in the Olympics, but at least she got out there. Okay, so what are your strength goals? What should you be able to do? I put this in here because, too often we're told, oh, get stronger, oh, do this or that, but, we're Americans. We like to keep score. We're all competitive. We want to have goals, right? All right, so for push-ups, And this is, I found this by looking at a bunch of different reviews and papers and stuff. There's really no set number, so this is just sort of an estimate. So don't like take this as the Bible. This is just like an estimate based on the information I could locate. If you're about 45 years old for push-ups, you should be able to do 14 push-ups as a 45-year-old female. If you're a 55-year-old female, you should be able to do 10 push-ups. If you're a 45-year-old guy, you should be able to do 16 push-ups. And if you're a 55-year-old guy, you should be able to do 12. And I'm talking about in a row. And real push-ups, not knee push-ups, like normal push-ups. Heart rate should be, your resting heart rate should be somewhere between 60 and 100 beats per minute. Okay, that's while you're just sitting here doing nothing, assuming you're not stressed out. Your 1 minute sit-up test, so remember, well, they don't do it anymore, but I don't know if y'all remember the Schwarzenegger physical fitness test that we used to do in school. And you would do a 1 minute sit-up test. So for men, 46 to 55, you should be able to do 22 to 24 sit-ups. That's not a lot, right? Women, only 14 to 17, and that, like, you're in the top echelon of society. And then air squats. So this girl is doing an air squat, meaning with no weights, no bars, no dumbbells, no kettlebells. Women should be able to do 39 before they fatigue out, age 55. And men, age 55, should be able to do 57. So these are relatively simple strength goals that you can achieve even if you can't do a single one of any of this right now.
There's value in air squats without weight.
Is that a question?
Yeah.
Oh. Somebody just asked, is there a value in air squats without weight? Yes, that is body weight exercise. You're just using your body weight to do the squat, okay? Now, eventually you're gonna wanna add weight, of course, because you wanna do progressive overload. But you should at least be able to do an air squat, right? Motivation. So everybody remembers Rocky running up the steps in Philadelphia. I've run up those steps myself when I was in medical school in Philadelphia. Set realistic goals and you won't be frustrated. Don't say to yourself, I'm gonna go run 20 stadium steps at Tiger Stadium tomorrow. And then when you get there and you can't do it, you get frustrated and you're like, never exercising again, that's stupid. Set a realistic goal and then stick to it and be consistent. Maintain, though, a long-term vision. So you want short, realistic goals that you can achieve with the long-term vision of, I am going to be able to sit on the floor, play chess with my grandkids, jump up, throw a football with them, go to the pool and play pickleball with my friends later. Why not? I think those are achievable goals. Don't focus on the failures too much. They happen. Move on, okay? But don't think it's totally okay all the time either. Like, oh, I missed my workout today. And then next thing you know, it's 4 months later. Don't beat yourself up for missing it. Just get out there again next week, okay? And then be optimistic. So I'm trying to get you optimistic about this. Understand how neuroplastic your brain is. Your brain is able to change connections, prune things, clean things up, make stronger connections, and develop enhanced cognition just with use, okay? Your brain can do that. Your body can get stronger. Your muscle has the ability to enhance its efficiency, its strength, its contractile properties, its size, and its endurance, and overall the ability of human beings to change. We can all change, and I just showed you and told you that your cells turn over very quickly at the molecular level, meaning the amino acids, the proteins, and the fats are constantly being recycled and changed very quickly, and then the entire body flips over every 7 years. So you have this ability to change and adapt, okay, with very few exceptions. There are always exceptions, but the general rule is the human body can adapt and overcome, as can the human psyche and the human mind. So the key is choose things that you like and that you will actually do, okay? If you hate running, don't try to become a runner. Walking is just as effective. A lot of my patients love pickleball. Water aerobics work. Dancing. A lot of people love dancing. Get out there and dance. Basketball is the #1 go-to for many people for exercise. And then whatever you like. And then what I'm trying to emphasize and what I'm hoping you'll pick up and love to do is weightlifting. You've got to lift heavy things. That's the #1 way to protect your brain, protect your body, protect your weight goals, and live a long and great life, is to not get sarcopenic. Keep your muscle mass. So remember we talked about opportunistic exercise. NEAT is non-exercise activity. like just fidgeting and normal movement through the day, just try to move as much as you can. Every day, try to increase your daily activity, and please don't make things super duper easy for yourself. One of my number one pet peeves are all these new shoes that you don't even have to bend over to put the shoe on. To me, that is the height of laziness and enhances and exacerbates any stiffness or pain problem anybody's gonna have. If somebody never even has to bend over to put a shoe on, why would they not get stiffer and weaker? So just look for opportunistic exercise and don't look for ways to make things so easy it's ridiculous. And then literature review. So I'm putting this in here because I want you to know this is not just anecdotal from my practice in education, but there's studies that back all of this up. Now, I put this picture here. If anybody remembers Ferris Bueller, anyone? That teacher that bored all of the children in class. So this part might be a lot for some of you, and you may want to like go get a cup of coffee or something, but I'm going to go through some of the studies that support what I just told you.
Producer letting you go get coffee.
Okay. So this study is titled Strength Training in the Elderly, a Useful Tool Against Sarcopenia. Sarcopenia is a technical definition of when we lose lean body mass or muscle mass as we get older, okay? So this study highlighted the effectiveness of progressive and supervised strength-based resistance training. So this is people that have guidance, a physical therapist or whatever. Strength training, even with high loads, like heavy weights, can significantly improve muscle strength, power, and body composition in older adults. And their point was, it was a safe and effective way to maintain muscle mass and avoid sarcopenia. They emphasize the need for supervision by qualified personnel until you know what you're doing, okay? But you could do squats, deadlifts, and things like that, snatches, whatever, as long as you've got somebody that knows what they're doing, showing you how to do it in a safe manner, it is possible and it will prevent muscle loss. Okay, increasing muscle mass with diet and exercise. We didn't really talk about nutrition. We're going to a little bit now. Not only must you exercise, but you must give your body the needed micronutrients and macronutrients to build the muscle. So what am I talking about? Protein, of course. You have to have enough protein, and then there's other micronutrients that are necessary. But if you're not eating enough protein, the resistance training, the weightlifting that you're gonna do, 5 pounds, 10 pounds, 40 pounds, it's not going to help you build muscle unless you've got the building blocks. So adequate protein intake, the consensus seems to be trending in a little bit higher level. So this is not hard and fast, but generally right now, everybody's saying 1 gram per kilogram body weight per day of protein that you need to eat just for basic life, okay? To not become sarcopenic, just sitting around. Now, if you're gonna add muscle, you're gonna need to eat even more than that. And we're gonna talk about what does that actually mean. Essential amino acids, particularly the amino acid leucine, seem to play a critical role in your muscle growth, okay? Leucine triggers this molecule called mTOR, the mammalian target of rapamycin. mTOR triggers the whole cascade of making protein in your body, making muscle, okay? Leucine triggers that. So you need to have good protein quality, high quality protein, and what is probably going to seem like a lot of it to you in combination with lifting weights if you want to get stronger. So remember, your muscle tissue changes as you age. We already talked about the turnover at the molecular and cellular level. Sarcopenia is the involuntary loss of muscle mass, strength, and function, okay? It's not like anybody wants this to happen, therefore it's involuntary, but it does happen. The only way to prevent it from happening is eat enough protein, lift heavy things every now and then, okay? And then obviously also, or maybe it's not obvious, you can't have a major detrimental illness like a hip fracture, pneumonia, anything that's gonna lay you up in bed in the hospital in a catabolic state where you're fighting off some sort of insult to your body. That dramatically depletes most people's muscle, and that causes sarcopenia. So you want resistance anaerobic training, but really resistance is the best way to get strong. And then this article talked about nutritional manipulations, such as increasing protein amounts, changing the amino acid composition of what you eat, et cetera, et cetera. But there's no need to get too crazy in the details until you get to the point where you look like the bodybuilders we were talking about. But what you need to know is you're probably not eating enough protein, if I had to guess. I know I don't eat enough protein. And every day I try to eat more. It's really hard, and I'm gonna tell you why. Growing Stronger, Strength Training for Older Adults. Now, this is actually on the CDC website. You can find it yourself. It's a detailed strength training program specifically designed for older adults. Now, bear in mind, it's probably not going to be as comprehensive or as outcome oriented as like what you would get from your physical therapist or personal trainer, but it's a place to start and it's freely available. Easy to learn exercises that have been proven safe and effective through research. So this is like your basic way to start, and the whole point is to build strength, bone density, improve balance, reduce fall risk. Because obviously that is a great public health concern. Okay, relationship between muscle mass and muscle strength with physical performance. So the muscle mass, the amount of muscle that you have, the strength of the muscle that you have really dramatically impacts your physical performance. So hypertrophied or big, beautiful muscles sometimes aren't strong muscles. So not only do you want mass, but you want strength. And if you had to pick one of the two, you want to pick strength, okay? Resistance training is the best way to prevent sarcopenia. It almost seems like an oh duh, but we forget sometimes the simple things. There is no pill for sarcopenia and there is no pill for exercise, okay? So this study gives some evidence-based recommendations for resistance training programs, especially for older people, including individualized and periodized approaches with intensity and volume. What does that mean? Volume is the amount of weight and how many times you lift it over time. So like a square, X times X, amount times number of times you lift it. So the more volume you do, the better. And the volume will change based on the amount and the number of reps, right? But really for you, again, 3x5 is fine. Harvard Health has this article about preserving your muscle mass. So progressive resistance training, we keep saying the same thing over and over again. Gradually increasing workout volume to build muscle and avoid plateaus. So unless you're progressively overloading or changing the exercise itself, or you got to change things periodically, your body has no signal to change. The body has no signal to adapt. If you continually do the same thing, let's say you sit on the couch all day and watch daytime TV and terrible commercials all day, well, your body has no impetus to get stronger or fitter or more flexible or better, right? But if you're out there doing things, going to the gym, playing pickleball, your body will get better because it's noticing that. It has innate capacity to sense the load being put on it and to adapt to it. And again, this study talks about protein, super important, we always forget it. 1 to 1.3 grams of protein minimum per kilogram, okay, per day. For older adults, if you're in resistance training, some people would say 2, okay? The bare minimum is 0.8 to just not fall apart, 0.8 grams. But really, if you're gonna get out there and start lifting, let's say you don't really exercise much and you're just gonna get that out there and do 2 pounds or even just using your body weight, no resistance to start, you still have to have 1 to 1.3 grams of protein per kilogram per day.
I don't know what kilograms are.
I know, we're gonna talk about it in a minute. Everything in scientific literature is in metric units, so I apologize for that, but later on I'm gonna tell you what does that mean on a daily basis in terms of like ounces and pounds and stuff. So basic protein requirements are because of the protein cycle in your body. Protein is needed for strength. 80% of muscle mass is protein, okay? The rest can be connective tissue and water and things like that. Your body will break itself down to find amino acids it needs for other things. So you need amino acids for neurotransmitters in your brain. You need amino acids for hormones. You need amino acids for connective tissues like skin and bone and things like that. And if your body doesn't have the amino acids it needs, like if you're not eating enough protein and you're malnourished, your body will begin to break down what it thinks maybe is less important, like your muscle, to provide the amino acids for the other important things you need, like neurotransmitters and hormones and whatever. So this is going on all the time. You're always recycling protein and using it for different things, and your body prioritizes essential life functions and non-essential. If you're not giving it enough building blocks, it's gonna cut off the non-essential stuff, and you'll lose muscle mass, and you'll get sarcopenic. So you gotta eat enough protein. Okay, and again, this is just showing you muscle, a big close-up of what a muscle fiber actually looks like. And there's just a bunch of different proteins involved. Myosin, actin, okay, and then all the connective tissue holding it together, troponin, G-actin, all of these, what happens is the myosin and then actin connect and pull the fiber and you contract, and that's how muscle works. But it's all protein. And then the mitochondria is made of protein, and the protein signals that induce muscle protein synthesis are made of protein that go to the genes and say turn on gene and turn on the muscle protein functionality of the body. All of this requires amino acids, and amino acids are in proteins. Okay, this article, the amount of protein required to improve muscle mass in older adults. This is from the European Society for Parenteral and Enteral Nutrition Expert Group and the ProTage study, okay? Parenteral and enteral nutrition, that's when people are in the unit, the intensive care unit, and they're getting fed through tubes and through their blood, right? So this group found the minimum protein requirements for muscle mass. And, sorry. And they recommended 1 to 1.2 grams per kilogram per day for healthy older adults. If you're malnourished, up to 2 grams, so almost double, okay? And then increased absolute protein amount of about 1/2 gram from normal protein will help you gain more muscle. So in other words, you have to eat a certain amount of protein just to not deplete your own body of amino acids. You've got to replace what's recycled every day, what you pee out in urine. Urea is just peeing out nitrogen, right? And nitrogen is a fundamental component of proteins. So for you to not just deteriorate, the minimum is 1 gram per kilogram per day, okay? But if you want to get stronger, you're going to have to eat more protein, and there's just no way around it. Okay, and this is just a little bit more talking about low protein intake versus high protein intake conditions. We've already talked about it. So enzymes, so how does protein get moved through your body? You eat the protein, right? Like let's say you ate a steak. And then the enzymes are going to break down the protein into its functional amino acids in the gut, in the stomach. Then those amino acids are going to be absorbed through the intestinal lining and then put into work somewhere in the body. Now, your body doesn't really have a great place to store energy from amino acids. So this is really more like building blocks, okay? The only place to store protein is skeletal muscle, okay? Your strength. Whereas you could store energy as fat or glycogen, right? So you could store glucose and fat, obviously to no end, but there's really no great way to store protein except in muscles. And so your body has to have a constant source, and it's constantly making things in the body. Again, neurotransmitter, hormones, whatever. So there's constant production going on, constant recycling, constant waste. So you have to keep feeding yourself the amino acids. You get the amino acids, they get absorbed through the gut, and then they go to the liver, and the liver is the primary place where a lot of proteins are put together and built, with the exception of skeletal muscle, of course. And then, of course, some of the proteins are put together in bone. But the liver's making all of the random little proteins that you don't think about on a daily basis. Eventually, nitrogen is pulled off of amino acids and excreted as urine. And then the remnant of the amino acid is recycled, okay, and eventually excreted over days to weeks. So you always break down amino acids between when you eat it and you eventually excrete it or dispose of it as waste. So you're constantly having to replenish this, especially if you're going to get stronger. So what is the protein intake for optimal muscle maintenance? This is from the American College of Sports Medicine. And again, it's higher, right? They're recommending that older adults that engage in resistance training who are going to lift weights consume 1.2 to 1.7 grams of protein per kilogram per day, okay? And then they emphasize that you should distribute that protein intake over time throughout the day. But honestly, if you can only get one big meal a day, then just get it then. I mean, just get the protein in. And then once you establish that and start getting stronger, you start worrying about esoteric things like, oh, I need to eat protein 30 minutes after I exercise or whatever. But really, you just need to get enough in on a daily basis. You can consume it within an hour of exercise. Some people believe that that optimizes your muscle ability. This is why you see bodybuilders slamming protein shakes at the gym, because they're trying to get the protein in within the same time frame that they exercise. I don't really worry about that. I don't think you necessarily need to worry about that. You just need enough protein. Wait, okay. The timing. So this slide, and you may or may not be able to see it, but it's a graph that shows the dose-response relationship to your protein intake and when you're synthesizing protein in the body. And it used to be thought you had to distribute it a little bit more carefully through the day. But really what happens is even if you eat one large meal of protein, it's broken down to amino acids, over the next 12 hours or so, it will be utilized effectively. So the important point is to get enough protein in and then worry about timing it properly. So every dose of protein throughout the day to achieve that 1.2 to 1.7 to 2 grams per kilogram of body weight per day, every meal needs to have 20 to 40 grams of protein. Okay, and right before sleep, you should get about 40 grams. And then you want high quality protein. Now, I believe in the Mediterranean diet and I'm an omnivore, but if you're gonna eat meat, it needs to be high quality, grass-fed, grass-finished meat. It should never be processed meats, okay? A lot of people are strong advocates of just plant-based proteins, and there's a lot of protein in plants. Shiitake mushrooms have all 8 essential amino acids. Soy protein is just like eating a steak in terms of the amino acids you're getting. So you just make sure you get really high quality. The problem with plant-based proteins, it's a very inefficient way to get protein and you're gonna have to eat a lot more. So each meal or each time you eat protein, 20 to 40 grams, and I'm gonna explain what that means. And it can either be animal-based or plant-based. If it's gonna be animal-based, please make sure it's not ultra-processed. Okay. Are you eating enough protein? And this is from Harvard Health. Again, 1 to 1.6 grams of protein per kilogram of body weight per day. So what is kilograms? So if you're a 70 kilogram person, you're about 150 pounds, okay? So this study again said spread the protein through the day. So breakfast, lunch, and dinner, maybe some snacks, whatever. If you time restrict eat, it's gonna be harder to do that. And then consume your protein-rich meals after your workout. So while so you work out, the body senses it, it starts that cascade, which begins with the genes that turn on protein synthesis. They get stimulated by certain signals. That process starts after you work out. So they're saying eat the protein and provide the building blocks during that time frame. Again, this is getting too complicated. Just eat enough protein and just lift a heavy thing once in a while. Okay, more of the same. We can skip on. So, okay, 25 to 30 to 40 grams. So let's even it out and say 30 grams of protein every time you sit down to eat is gonna help us achieve that, let's call it a 1.5 grams per kilogram body weight per day protein intake need. Okay, and it is needed. To reach the threshold for maximal stimulation of muscle protein synthesis, to let your body make the muscle to make you stronger to achieve all those health benefits we talked about, every meal is gonna have to have 25 to 30 grams. So what is that? 4 ounces of chicken, basically. This is showing you about 30 grams of protein on a plate. Turkey breast, about 4 ounces. A chicken thigh is about 10 grams of protein. So that means you'd have to have 3 chicken thighs per meal. Now, how many of us do that? A chicken drumstick's only 11, so 3 to 4 drumsticks per meal if that's your only protein source. So on and so forth. So again, I don't think many of us eat as much protein as we should. Probably one of the reasons most Americans get sarcopenic. Remember, protein keeps you not hungry through the day, so you're not gonna want any extra snacks of like high carb, ultra processed foods. You're gonna not desire unhealthy foods as much. And the protein's gonna help you gain the strength and provide the building blocks your body needs for almost all of its functionality. So don't be afraid of protein, I guess is where I'm going with this. Now, the only caveat being, if you have kidney issues, then yes, you need to go talk to your physician for sure, and of course you should talk to them anyway. But your kidney is needed to be able to excrete the nitrogen like we talked about earlier. You have to have good kidney function to handle high protein loads. And when I say good, just normal. Okay, so what foods? 5 hard-boiled eggs is 30 grams of protein. So that means we should be eating effectively 5 eggs every meal. Now, how many of us do that? Really none of us. Now, I have a great source of eggs because I get them from a couple of my patients that have cage-free, organic-fed, free-range, roaming chickens on their land, and I buy eggs from them. So you, again, high-quality protein source, but that is a lot. 5 eggs at once is a lot. It is really hard to get through that. That's how much protein you need multiple times a day. Think about it. So I bet you're not getting enough protein because I know I'm not. And then if you're gonna start lifting weights on top of it, you definitely need this much. And this just shows you multiple different sources of protein. Again, There is protein in vegetables. Don't think there isn't. Almost everything has protein in it. It's just really hard to get enough. Lentils are an amazing source of protein. Soy, tofu, Brussels sprouts, any kind of bean and legume, great sources of protein. You're just gonna have to remember you gotta eat more of it.
You have a comment
All right, we got a comment.
from Donna.
Okay,
Cartier, Cartier. She must be a patient.
Cartier, Donna Cartier.
Yeah. She said, "Thank you, Dr. Warner. I needed to hear this info to get right on track. I know where to start. Protein is hard being plant-based, but she's gonna do better."
Yeah, so
She
Donna's,
wants meat back. Appreciate it.
yeah, Donna's making the comment that protein is hard to get when you're just plant-based. I agree. Now,
They have protein powders, plant-based.
yeah, there are protein powders that are plant-based, but they're, again, an inefficient source of protein. The best protein powders for, trying to increase your protein intake are gonna be whey and casein. And what is that? Those are milk proteins. One is just easier to absorb than the other. But really, the best way to get protein is whole foods made by yourself that aren't ultra-processed, right? And yeah, it's hard to eat a lot. I don't think I could get enough protein on a plant-based diet for 100%, not with my lifestyle, with work and everything. I find it difficult even with meat. And especially if you're trying to buy just high quality meat, it's really hard. But the whole point is just try to eat as much protein as you can. Don't forget edamame. If you like edamame, that's the soybeans in the pod. You just quickly throw them in some boiling water and salt them up. That is an amazing source of protein. So there are great plant-based sources of protein that you can snack on throughout the day. The whole point is you need more protein than you think you do, probably. And especially if you're gonna be lifting heavy things, which I hope that you will after this talk.
Quick question
We have another question, hold on.
from Deidre. Does swimming laps in a pool suffice instead of lifting weights?
Deidre wants to know if swimming laps in the pool suffices for, I guess, resistance training rather than just lifting weights. I would say if you're swimming fast enough that the resistance of the water becomes an effective weight, yes, but you're not really fighting gravities per se, not as much in the water. And I don't think that it's putting as much strain on the muscle and the bone. It is great for aerobic, it's great for stress management, and you will get stronger. Obviously, Michael Phelps is not a wimp, but he also weightlifts on the side. So I would say swimming is a great place to start, but I'm here to tell you, all of us need to lift heavy things once in a while, if it's at all possible. Okay, what supplements might help me as I'm trying to get stronger, get healthier, and gain muscle? So there are some herbal supplements, there's flavonoids, there's phytochemicals, and all of these can support your strength goals, your aerobic goals, and most importantly, your recovery goals. Remember I told you 3 to 5 days a week? You gotta space out the days to recover and also to allow that protein synthesis to happen. Now, this I put in, this paper, because I want you to know that elite athletes use supplements more than anybody else, and there's a reason for that, because they actually do help performance and help recovery and make people feel better. So you can maintain a better state of health and recover between sessions with supplements, particularly if your diet is not perfect. And very few people have the resources and the time and the ability to have a perfect diet, okay? Even elite athletes, a lot of them don't. 2/3 of 3,887 elite track and field athletes take supplements. This is the world championship level. That's just one study. So this is not woo, this is not something to poo-poo. These are important to support your goals of fitness. What supplements really help when you exercise? Remember I told you early in the talk that exercise short-term induces inflammation and reactive oxygen species? One of the best ways you can downplay the excessivity of that, or like reduce the damage from it, now you do need some of that to signal the body to build protein, but you don't want to be excessively inflamed, right? Because that causes problem. Anthocyanins seem to have the best track record with this. This is the plant phytochemical that you find in pigmented plants. This is why my tart cherry extract has been one of our best sellers of all time. Tart cherry extract is so good at reducing pain because it is an anthocyanin, okay? It is a natural antioxidant, flavonoid that reduces inflammation, reduces pain, and has a side effect of reducing uric acid in the blood system and reducing urate. So I actually recommend tart cherry extract often for my gout patients, just to stay on it baseline. It prevents gout flares and gout attacks. But for all of my patients that have arthritis, I also recommend tart cherry because it reduces pain. And then for anybody that's just interested in getting stronger and being healthy, this is a go-to, easy way to get a lot of flavonoids and anthocyanins in you without getting the sugar involved in tart cherry juice and the fructose in that, and also if you're gonna sit down and eat 150 to 200 cherries. Again, who has time for that? So I just take a capsule which has 1,500 milligrams of tart cherry extract, which is predominantly the anthocyanins. This is the stuff you find in purple sweet potatoes, purple berries, blackberries, blueberries, things like that. They improve strength, especially hand grip strength, and we're about to talk about that, improve physical performance, and mitigate the effects of aging.
And you talk about how tart cherry is a better alternative to NSAIDs.
Oh, we had a question of why would tart cherry help with pain and be a better alternative than the non-steroidals? So tart cherry, turns out, reduces the activity of what are called the COX enzymes, the cyclooxygenase enzymes. These are the proteins in your body that convert phospholipase A2, which is in the cell membranes, into things like prostaglandins and eicosanoids, okay? Those are the inflammatory proteins that cause inflammation, or what you know of as inflammation. So the way that ibuprofen, meloxicam, all those drugs work is they block these enzymes too. Some of them block COX-1, some of them block COX-2, some of them block both. But they block them at such a massive level and with such intensity that they actually cause damage elsewhere. So there's cardiac risk with NSAIDs, there's GI risk with NSAIDs, there's kidney risk with NSAIDs. You destroy your gut biome with NSAIDs. But with tart cherry extract and other natural ways to block the COX-1 and 2 enzymes, you don't get any of these side effects. At least I've not been able to find literature with any adverse events like that. So it's a great way to manage pain naturally with the same enzymes being targeted, but none of the side effects. Oh, okay. Here's another study, effect of flavonoids on skeletal muscle mass, strength, and physical performance. This was a meta-analysis. That means they take multiple studies and combine the data from all the different studies. And they were looking at the effects of flavonoids, which are the plant chemicals like the anthocyanins we just talked about, on sarcopenia-related parameters in middle-aged and elderly people. And they found that in people that took these supplements, they had good benefits, significant benefits in appendicular muscle mass, mass gain, and improved physical performance. This is just one of the tests they did. This is called the timed get up and go test. It seems like a simple thing. Surprisingly, a lot of people as they get older are not able to perform even at this level. This is when you're sitting in a chair and you get up, you walk forward, turn around, come back, and sit back down. You have a therapist that can time that and see how fast you do it. And you should be able to do it in a certain speed and a certain number of times. And ideally, you can get out of a chair without leaning way forward and using your arms to do it, okay? That's a measure of quad strength, balance, power, etc. So flavonoids, turn out, helps this. Okay, this study is the effects of protein and supplements on sarcopenia in humans. Okay, everything we've talked about. So this review discussed different supplements, including fish oil, one of my favorites, or omega-3 with DHA and EPA, citrulline, okay, and they found positive effects in muscle mass in older humans. So fish oil supplementation, and this is our omega-3, which has a good ratio of DHA to EPA and is marine source, third-party tested, no pesticides, no heavy metals. It enhances the effects of strength training by improving muscle strength and performance. So if you take omega-3 every day and you're eating protein and you resistance train, you're gonna be able to fight off sarcopenia. And omega-3 has the added benefit of reducing inflammation overall, so it'll help pain. And it embeds itself in cell membranes and makes all cell membranes more flexible, so you can help your flexibility. There's different tricks that you can do to help you on your quest to gain the strength that you need for optimal aging. So, dietary phytochemicals as a promising nutritional strategy for sarcopenia. Another paper, okay? This thing that you're seeing with the hand, that is a hand grip strength thing. Turns out hand grip strength is one of the primary ways to predict longevity. So based on somebody's hand grip strength at whatever age they are, you could predict really how long they're going to live, or if they're healthy for their age. So this is a systematic review and meta-analysis that evaluated the benefits of botanical, meaning from plant extracts, and their phytochemical compounds, phyto is plant, so plant chemical compounds, for muscle health in older adults. The findings suggest that dietary phytochemicals significantly increase hand grip strength and physical performance. They had no effect on increasing muscle mass, but the strength got better. Remember, I told you, you can have huge muscles that aren't strong. What you really want is strength. So dietary phytochemicals are very important in helping you gain those goals. We've talked about protein. I am an omnivore and I believe in the Mediterranean diet, but you certainly need to be eating a lot of fruits and vegetables so that you can get all these phytochemicals. Now, I still supplement with things like tart cherry, turmeric, omega-3, all of the different mushroom phytochemicals that are found in like our Energy and Focus supplement. But really, you need to still be eating the vegetables and the fruits also. So this is a grip strength. If you are in physical therapy or you have access to one, they should be able to check this for you. There's an age column, male, female, and then weak, normal, strong. So let's say you're 50 to 54, woman, age 50 to 54, you should be able to pull in that dynamometer and hit 70. And then that means you're strong, okay? So these are different little things you can do to test yourself and periodically check your progress. One of the most important things is grip strength. And guess what? Doing this, not only are you working the arm and the shoulder, you're working your grip.
Donna has a comment.
Okay, I have another comment from the audience. Go ahead.
She loves it. Walther's tart cherry and omega-3 are excellent. Learned about it a few months ago. I'm so glad that I found it.
Oh, thanks, Dawn. Dawn says she loves the tart cherry.
Donna.
Oh, Donna, sorry. I thought she said Dawn. Thank you, Donna. She loves the tart cherry and the omega-3. I, too, love them, and I appreciate that you do as well.
Our omega-3 is very special. You don't find that much of the DHA.
Yeah, so we curated our omega-3s specifically to have a little bit more DHA, which is really good for brain health, by the way. All right. Does flavonoid consumption improve exercise performance? Another study. This review systematically, meaning they went through multiple papers in a systematic way, assesses the available evidence on the effects of flavonoids on exercise performance and exercise-induced changes in immune and inflammatory biomarkers, so things like CRP and sed rate that you check in your blood to see how inflamed you are. Flavonoids like cocoa flavonols, this is why dark chocolate is promoted as healthy, green tea flavonols, and blueberry anthocyanins, again, also in tart cherry, have, quote, demonstrated success in counteracting exercise-induced oxidative stress due to their antioxidant properties. So again, you want a little bit of the stress that happens with exercise. You just don't want prolonged chronic inflammation or prolonged chronic oxidative stress. And I've talked about this in almost every talk. These are the scourges of our modern lives and the primary reason that we quote unquote age. It's not time, it's oxidative stress and inflammatory burden over time. Flavonoids can help reduce that burden, especially as you're starting to try to put even more physical stress on yourself by exercising. Okay, this is from the National Institute on Aging, your tax dollars at work. Dietary supplements for older adults. It just goes into various dietary supplements, including things like ginkgo, ginseng, etc. Basically, the upshot of this government website is check with your doctor. So they're, I don't want to say they're very pro-natural stuff because it just doesn't, I don't have that feeling from the federal government on a general basis, but they don't really say it's bad. They just say check with your doctor, which you always should. Certain drugs, for instance, turmeric, if you're on warfarin for blood thinner, you probably shouldn't take turmeric because they hit the same liver enzyme for processing and sometimes they interfere with each other. So there are certain things to remember. That's why you should always check with your doctor, at least somebody that knows. A lot of doctors aren't going to know about this, sadly, but find one that does. Okay, here's another one. Dietary supplements for exercise and athletic performance. Okay, it's a fact sheet and it provides an overview of selected ingredients in dietary supplements that are designed to enhance exercise and performance. It includes information on amino acids, protein, creatine, and caffeine, which are commonly used to improve endurance and strength. Quercetin is a polyphenolic, again, that just means from plant, flavanol from plant, and it's highlighted for its potential benefits in increasing mitochondrial number in muscle. You may remember from one of my other talks, the mitochondria is the engine of every cell. This is what converts food to fuel that your body can use. The more mitochondria you have, the better. The more quality mitochondria you have, the better. Quercetin can increase the number of mitochondria in your muscle, okay? Reduce oxidative stress and improve endothelial function. Endothelial is blood vessels. So if you're gonna get more blood to a muscle that has more mitochondria, you're gonna be far more effective, better able to do things and perform physically and get stronger. Quercetin is found in things like elderberries, red onions, white onions, so it's heavy in onions, believe it or not, so don't be afraid of onions anymore. And then it just kind of goes down the line. My supplement, the Daily Immune Complex, has quercetin in it. So that's a way you can get it without having to chomp down 4 red onions every day, okay? But quercetin is also a longevity molecule along with resveratrol and NMN. So it's being studied for its life prolonging abilities. But for you, know that it's gonna help you exercise.
And the Daily Immune also has elderberry and all that.
Yeah, the Daily Immune also has elderberry in it. Okay, now we're gonna talk specifically about exercises. I know this is what you've been waiting for. What you can and should do, assuming it's okay with your treating physician, okay? Again, this is informational and educational. So I'm gonna give you 4 exercises and tell you how to do them that involve multiple muscle groups. So they're whole body exercises that work joints, connective tissue, flexibility, and muscle all together to give you whole body functional strength. So you can go from this lady here on the left to this lady here on the right. It is possible. The deadlift, okay? You can use a curl bar or a kettlebell. This is gonna hit your hand, like many muscles in your body, your lower back, your core, your forearms, your grip, your hamstrings, your glutes, which is your butt muscles. So this kind of tells you how to do it. Basically, you start on the ground there, and you could do this with just the air, or do it with a 3-pound bar, or do it with a couple of 5-pound kettlebells, or you can go get these. These are nice little things. They're like, it's like a weight stick. You could just do this. This one is 4 pounds, I think. The standard bar at a gym, I think, is close to like 45 pounds. So you may not even want to start with a bar. That might be too much. Go get one of these. You can get these on Amazon. That's what I did. It's called the Can-Do, C-A-N-D-O. Okay? Basically, you put your feet shoulder width apart, bend at the knees, try to keep your back more or less straight. So remember, you're going to be using your quad and your butt, and you're basically going to be lifting this bar just to here. That's it. That is a deadlift. You can do that. You've done a deadlift. Do 3 reps, 3 sets of 3 reps, so a total of 9, 3 times a week with 3 to 5 minutes of rest between. The deadlift. That is a great whole body activity that you can do. And then think about this when you go on your walk with your buddies and you say, oh yeah, I just deadlifted today. They're gonna be so impressed with you. The goblet squat. This is another great one, whole body. Again, this you would use a kettlebell usually, and you're gonna be holding it like here and doing a squat. See, it's called a goblet squat, I guess, because you're lifting a goblet. But basically, this is putting your legs a little bit wider out than you would with like the deadlift or a regular squat. So it's working slightly different leg muscles. Again, you're improving grip strength, shoulder strength, arm strength, chest strength, back strength to help with posture. So I tell people to try to make sure your shoulder blades are drawn together, like towards the midline or towards the spine. And you're gonna go down and up. Again, 3 reps, 3 minutes of rest between, 3 sets. Alternate it with the deadlift, okay? Now you're up to 2 exercises. You're already almost all the way to your goal. The bent over row. Again, curl bar or kettlebell. If you want to start lifting weights, a kettlebell can be used for almost anything. This is the bent over row. Literally what it sounds like. You're bent over and you row. So this is working a lot of your back and your core, also your grip, also your forearm, also neck muscles, also quad. So it's a whole body workout. Again, if you have no idea how to do this, just please get a physical therapy prescription from your doctor and go and say, I would like to reduce my sarcopenia, improve my balance and coordination and my joint pain. A lot of times they have to have a pain diagnosis, so I'm sure you've got pain somewhere, like fix my knee pain. But I really like to start deadlifting, bent over row, and goblet squatting. Is that possible? And learn how to do this. These are easy to do. You can do it at home. You could just fill a grocery bag with something heavy. You don't even have to go buy weights. And then the overhead press, another one. Again, same thing. Curl bar, kettlebell, even the can-do weight watte bar. This is from Japan, a watte bar. Same thing. So you're going to be doing an overhead, literally an overhead press. So you're pressing away from yourself. Bent knee, and then he straightens it out as he goes up. If you get really good at that, then you progress and you can do it with a single leg lunge like that. A million ways to modify these exercises, and you'll learn more as you go. But I just gave you 4 whole body exercises that are relatively simple to learn and do, that you can start with no weight, advance to 1 pound, 2 pound, whatever, and go on, and you can gain muscle mass, assuming you're eating enough protein. Take your supplements to reduce the pain and inflammation and help your body adapt. Get the good sleep you need, get out there in the sunshine in the morning, walk with some friends to get your zone 2 aerobic exercise and do your dual task activities of talking and exercising at the same time. But these exercises are so easy. That's 4 exercises. If you did 3 reps of those 4 exercises with a relatively heavy weight based on what you can lift, you're gonna get stronger. There's just no question.
Can you clarify on the squat that you don't want them pressing in the squat position?
That I don't want them pressing in the squat position. What do you mean?
Yeah, like they do the squat, then they come up, then they press.
Oh, no, that would be a snatch. So if you're gonna do the goblet squat.
No.
Oh, the deadlift?
This one right here. This chick is down there. Just clarify that they need to come up, then do the overhead press.
All right, I'm gonna clarify. That this single leg lunge thing, she is coming up and pressing the weight up at the same time. So she has just basically made the overhead press slightly more difficult by adding the lunge at the same time. That's called a progression in exercise. So you make an exercise a little bit more difficult, like increase the level of difficulty.
And like, if people can't think of these things on their own, they can like get a subscription to Beachbody. They teach them how to do all
Yeah.
this stuff.
So
like,
my advice, I don't think that if you don't know what, if you're not an ex-athlete or you don't know what you're doing and this is all very, very new to you, my preference for my patients is that they don't go online and watch exercise videos or anything like that. I really think having an actual human being with actual knowledge with you when you start is very, very important. Thus, my recommendation to go to physical therapy, chiropractor, personal trainer, something like that, somebody that knows you, your situation, your limitations, and how to get you where you want to be. Once you get really, really good at it, or if you used to play college basketball, like my producer here, sure, you can go watch Beachbody videos all day. But for my patients, my advice is please go to physical therapy and start there. I can show you how to do stuff, but I cannot be with you when you're doing it normally. I just don't have the time. But you can go to physical therapy 2 times a week, 3 times a week, which is enough to do this protocol that I just told you about. So hopefully that I hope I achieved my goal of telling you why you should exercise, what it is, why it's important, the benefits of it, how to do it, and then how much protein you need and the supplements that could potentially benefit you while you do it. Tart cherry extract is a go-to. Now, tart cherry extract naturally has a slight bit of melatonin in it, so I usually advise people to take it more towards the evening time. The daily immune complex, again, has the elderberry and has quercetin, which you need. Most of us don't want to eat 4 red onions a day, right?
It also has
Zinc and all the things you would need for your immune system. Every talk, I can never say enough good things about omega-3. Huge fan. I take it every day. Personally, I take about 2 grams a day. The recommended dose is about 1 gram a day. And omega-3 or fish oil should really be DHA and EPA, okay? That's what you really want. You don't really want fish oil. It goes rancid. So these capsules are DHA and EPA, and I tell people once you get it, put it in the fridge to keep it from going rancid. Once you open it. Okay, the Energy Brain Booster series has a bunch of mushroom type phytochemicals in it that also provide for enhanced cognition and translation of neuromuscular function. And then please don't forget D3, also hugely important to enhance athletic performance and weightlifting, and generally for life. And all of us are D deficient, sadly. So yes, take your D3, get out in the sunlight. It's also in the Daily Immune. And then the Mindset gummies we just came out with have D3, B12, and magnesium, all great for nerve and muscle health. All right, and then don't forget, this was a very detailed sort of guide to exercise, but the whole exercise is just one facet of how you can start feeling better and treat yourself naturally and avoid people that wear white coats, right? Stay out of my office. The best way to do that is with this book, to try to enhance your ability to treat your body naturally. It gives you multiple things from diet to sleep to stress management, etc. Everything plays into itself, but exercise is going to be your best bet to age optimally and gracefully. Oh, well, you can find this at Amazon, Barnes & Noble, my website, you can get it. All of these sources. There is an Audible version if you prefer to listen to your books, Goodreads, etc. Your normal places to get books, I think. Any other questions? You guys had good questions. And then at the end, I just give you the sources that, some of the sources I used. All right, you're welcome. And so basically just get out there and move. Try to lift something and make sure you eat enough protein.
Burning in upper stomach.
Burning in the upper stomach. Somebody just asked me about burning in the upper stomach, if there's any help. I guess that's GERD, gastric esophageal reflux disease, or perhaps a hiatal hernia. What? Yeah, well, one of the best ways to treat any GI issue is to get a healthy routine diet, like eat at pretty much the same times every day, like within the same time window, and only eat whole natural foods and avoid ultra-processed foods, especially ultra-processed meats. That way, you can repopulate your gut biome, and a lot of these kind of what we think of as normal GI discomforts of life, like GERD, hiatal hernia, acid reflux, a lot of that just gets better if you start feeding your gut appropriate food like fiber and things like that.
Thank you.
You're welcome, Pam.
And
Deidre said thank you.
Yeah.
Yeah, hopefully this does help you. And, you know, I know a lot of women are scared of this. You're not going to end up looking like She-Ra, I promise, but you will get stronger and you will be happier if you're stronger. So just get out there and get started. And again, check with your physician. All right. We will be signing off now. Thank you for joining us. And don't share and like if you can. What? Oh, thank you for joining us. And don't forget to share with your friends and relatives or people for whom you think this would be helpful. We really appreciate it. We love getting the word out.